Nerves, the intricate wiring of our bodies. They are the silent messengers carrying signals to and from the brain at lightning speed. They allow us to feel the caress of a loved one, the warmth of the sun on our skin. But what happens when these delicate pathways are damaged? Nerve injuries, alas, are not uncommon. They can occur due to a myriad of reasons, from a sudden impact to a slow, insidious disease process. These injuries can disrupt the flow of information, leading to a bewildering array of symptoms. Pain, often excruciating, is a frequent companion of nerve damage. Numbness, tingling, and muscle weakness are also common. In some cases, the injury can even lead to paralysis. Understanding the causes and mechanisms of nerve injury is crucial for effective diagnosis and treatment. It allows us to provide relief to those suffering from these debilitating conditions and to develop strategies to prevent further damage. Imagine a garden hose. Water flows freely through it. Now, picture someone stepping on the hose. The flow is constricted, reduced to a trickle. This, in essence, is what happens when a nerve is compressed. Compression is a common culprit in nerve injuries. It occurs when a nerve is squeezed or pinched by surrounding structures. This could be a herniated disc pressing on a spinal nerve, a tumor growing near a nerve, or even tight muscles in the neck or back. The consequences of compression can be dire. The nerve, deprived of vital oxygen and nutrients, begins to malfunction. Pain signals, like frantic cries for help, are sent to the brain. Compression can manifest in various ways. Carpal tunnel syndrome, a painful condition affecting the hand and wrist, is a classic example of nerve compression. Sciatica, with its shooting pain down the leg, is often caused by compression of the sciatic nerve in the lower back. Nerves, like any other part of the body, need nourishment to function properly. They rely on a steady supply of oxygen and nutrients delivered through the bloodstream. When this supply is compromised, nerves become starved, their delicate balance disrupted. Metabolic disorders such as diabetes can wreak havoc on nerves. High blood sugar levels, like a corrosive acid, damage the small blood vessels that nourish nerves. This can lead to a condition known as diabetic neuropathy, characterized by pain, numbness, and tingling in the extremities. Nutritional deficiencies, too, can impair nerve function. Vitamin B12, for instance, is essential for maintaining the protective myelin sheath that surrounds nerve fibers. A deficiency in this vital nutrient can lead to a range of neurological problems, including pain and numbness. Our modern world, for all its wonders, exposes us to a multitude of chemicals. While many are harmless, some can have a detrimental effect on our health, particularly our nerves. Exposure to heavy metals, such as lead or mercury, can damage nerves, leading to a condition known as toxic neuropathy. These metals, like insidious poisons, interfere with the normal functioning of nerve cells. Even medications, intended to heal, can sometimes have unintended consequences. Certain chemotherapy drugs, for instance, can damage nerves, causing pain and other neurological symptoms. This is a cruel irony, a necessary evil in the fight against cancer. Alcohol, often consumed in excess, can also damage nerves. Chronic alcohol abuse can lead to a condition known as alcoholic neuropathy, characterized by pain, numbness, and weakness in the extremities. Pain, that unwelcome intruder, is the hallmark of many nerve injuries. But how does damage to these delicate structures translate into the searing, stabbing, or burning sensations we experience? The answer lies in the complex interplay between nerves and the brain. When a nerve is injured, it can become hypersensitive, sending pain signals to the brain even in the absence of a painful stimulus. Imagine a faulty fire alarm, blaring incessantly even though there's no fire. Inflammation, the body's natural response to injury, can also contribute to nerve pain. The chemicals released during inflammation, while intended to promote healing, can irritate nerves, amplifying pain signals. Adding to the chaos, damaged nerve fibers can crosstalk with each other, sending scrambled messages to the brain. This can lead to bizarre sensations, such as feeling a touch on the hand when the arm is touched. Nerve damage disrupts the normal flow of information, leading to a symphony of misfiring and pain. Section 6. Examples of painful nerve injuries. A glimpse into the abyss. Nerve injuries, like cruel gestures, can manifest in a bewildering array of ways, each with its own set of symptoms and challenges. Peripheral neuropathy, a common consequence of diabetes and other conditions, affects the nerves in the extremities, causing pain, numbness, and tingling. It's like wearing a glove or sock that you can't take off, dulling your senses. Radiculopathy, often caused by a herniated disc, affects the nerve roots that emerge from the spinal cord. This can lead to pain, numbness, and weakness that radiates down the affected limb. Imagine a tree trunk with damaged roots, its branches withering and dying. Neuromas, benign tumors that can form on damaged nerves, can cause intense, localized pain. They are like knots in a rope, disrupting the smooth flow of signals. Section 7. Unraveling the mystery diagnosis and treatment of nerve injuries. Diagnosing nerve injuries requires a keen eye, a listening ear, and a battery of tests. The physician, like a detective, must piece together clues from the patient's history, physical examination, and specialized tests. Imaging studies, such as MRI or CT scans, can reveal structural abnormalities that may be compressing a nerve. Nerve conduction studies, on the other hand, measure the speed at which electrical impulses travel along nerves, helping to pinpoint the location and severity of damage. Treatment for nerve injuries varies depending on the underlying cause and the extent of damage. In some cases, conservative measures, such as rest, ice, compression, and elevation, RICE, may suffice. Physical therapy, with its focus on strengthening and improving range of motion, can also be beneficial. Medications, such as pain relievers, anti-inflammatories, and antidepressants, can help to manage pain and other symptoms. In severe cases, surgery may be necessary to relieve pressure on a compressed nerve or to repair a severed nerve. Section 8. Taming the Beast, Pain Management Strategies. Nerve pain, often chronic and debilitating, can cast a long shadow over a person's life. Managing this pain, taming the beast, is essential for improving quality of life. Medications, while not a cure-all, can provide significant relief. Pain relievers, such as acetaminophen or ibuprofen, can help to reduce inflammation and dull pain signals. Anticonvulsants, originally developed to treat seizures, have also proven effective in treating nerve pain. Antidepressants, particularly those that affect serotonin and norepinephrine levels in the brain, can help to modulate pain signals and improve mood. These medications, like gentle guides, can help patients navigate the treacherous terrain of chronic pain. Alternative therapies, such as acupuncture, massage, and yoga, can also provide relief for some individuals. These therapies, while not a replacement for conventional treatments, can complement them and offer a more holistic approach to pain management. Section 9. Towards a Brighter Future, Hope and Innovation in Nerve Repair. Nerve injuries, once considered irreversible, are now viewed with a glimmer of hope. Advances in medical research are paving the way for new treatments that hold the promise of restoring function and alleviating pain. Stem cell therapy, a cutting-edge field, is being explored as a potential treatment for nerve injuries. Stem cells, with their remarkable ability to differentiate into various cell types, could potentially be used to regenerate damaged nerves. Gene therapy, another promising avenue of research, involves introducing genes into cells to repair or replace faulty genes. This approach could potentially be used to treat inherited neuropathies or to promote nerve regeneration after injury. While challenges remain, the future of nerve repair looks brighter than ever. With continued research and innovation, we may one day be able to restore the intricate wiring of the nervous system, bringing relief and hope to millions suffering from nerve injuries.